All right, so this time I wanted to talk about wound care, just some basics of wound care that will involve treating wounds with simple physical means and also with some of the herbs that we already know about, some of the herbs we've talked about in previous sessions. So that's going to be the focus for this time. And then we'll also have a couple of new herbs at the end. So, hang on a second. I want to turn something on and see if this is not too loud. Well, does that make a lot of noise? Hopefully everybody can still hear me okay.
No, not that it doesn't sound very loud to me.
Okay. So, all right. So, just a little. Okay, this is even a little bit better. So, I'm going to talk about some wounds and minor injuries, including some of the different kinds, how they're alike and how they're different, and what we do about them. So there are several different types of wounds, and we're just going to cover a few of them today. I don't want anybody to think this is all the different kinds that there are, but they're sort of the ones that you would see most commonly, and the ones that are easiest to treat with the stuff that we already know about. Hang on a second. I think we need to. Okay, that might make things connection a little better. So some of the major types of minor injuries, major categories of minor injuries that we'll be talking about are contusions, lacerations, incisions, punctures. Yeah, contusions, incisions, punctures, lacerations. So these are all very common types of injuries. Oh, hang on a second. Mm-hmm. All right. Sorry. Second, get this all arranged the way I want to. Not like that. That'll work for now. All right. So contusions are basically minor injuries usually that are caused by blunt impact. So bruises, these may involve some broken skin, they may involve bruising, they may involve a little bit of bleeding, not typically a lot of bleeding, or else it would get reclassified as a laceration. But basically bumps, bruises, that sort of thing. And these are a really common type of injury. A lot of the time they result from falls. A lot of the time they result from automobile accidents. They're something that we all experience from time to time, and sometimes people get a lot of them at once, like if they fall down a flight of stairs. Sometimes it's just one simple thing. Kids get them a lot because they're reckless and they kind of heedless of their own safety, so they tend to do things that leads to contusions a lot. When adults get them, they tend to be worse because we have more momentum behind us if we fall or if we run into something. So that's one category of injury. Another category of injury, also generally very superficial and minor, although if they're extensive, they can be pretty bad, is abrasions. Abrasions are scrapes, injuries that are caused by scraping against a rough surface. For the purposes of this, we'll just be talking about simple abrasions rather than ulcerations, which are more like a pressure injury from an ongoing thing. But simple abrasions, skinned knees, skinned hands from falls, those are the most common, very minor types like that. Sometimes you'll get something that's more severe, like someone falls on their face and skins part of their face, or if someone falls off of a bicycle or motorcycle, they can actually skin a very large part of their body. And in that case, it can be, a little more dramatic and a little more, a lot more painful and a little more complicated to treat. The thing to be aware of about abrasions is that even though they're very shallow, because they have a large surface area, they tend to affect a lot of nerve endings and be sometimes more painful than some smaller, more serious wounds, because we're really designed to feel things with our skin and with the surface of our skin. And that's what abrasions affect. They affect a relatively large area of the surface of the skin. So if someone skins their knee really badly, it might hurt more than getting jabbed with something that would actually be a more serious injury. So, a lot of the time, if a child falls and skins their knees, some of it's fear, some of it's, just making sure that they're in pain, but they actually might be in more pain than they would be from some other injuries. And, with adults, they're more likely to look at it and be like, okay, it's just a scratch, it's just a scrape, it's not anything I have to be alarmed about, and that can make things feel a lot better. So abrasions, scrapes, very common type of injury, again, often caused by falls, and being physically active and that sort of thing. They can be caused by industrial accidents and all sorts of other situations. Clothes that don't fit right sometimes, lots of things. So chafing is a minor form of abrasion. It is also an abrasion, but it's usually a very light form of abrasion that happens from repetitive scraping by something that's not especially sharp or rough, like clothing, or like another part of the body rubbing against another part of the body. But treatment is pretty similar for it. Next category is incisions. An incision is a cut. It is a straight cut with, generally regular margins. So it's not a tear, but it's a slice made with a sharp object. So incisions are really common in accidents with knives, chopping things, that sort of thing. They're also common in situations involving glass. So people hurt themselves with glass. Incision is not the only type of injury you can get from that, but it's a very common one. And then lacerations are tears. They can happen from glass, jagged metal. Often they happen from stepping on something or from falling against a sharp object. And this is where maybe something enters the skin, but then the force of forward movement or the force of stepping down causes a tear. So they have less regular margins than an incision, and they're not necessarily made by the object. The object that makes the injury does not necessarily travel the length of the wound channel. So you could, for instance, have something hit you here and leave a horizontal tear because it's moving along the length of your arm. So they're not always made in the same direction as the momentum. And like I said, they tend to have irregular margins and not be nice and tidy the way that an incision is. Even incisions can be pretty gory, but there's a different type of injury. And then punctures are another form of injury where something has poked through the surface of the body and continued into the tissue underneath. So puncture wounds are harder to treat because the wound channel travels into rather than along the surface. So often that can reach deeper things like organs and bones, depending on where it is on the body, and it can also leave behind pieces of whatever caused the injury or contamination, dirt, that sort of thing. So, stepping on a nail is a typical puncture wound. Getting shot with a bullet might also be a puncture wound, depending. That can actually go a lot of different ways, and we won't be getting into anything quite that extreme. Being stabbed with a spear, so puncture wounds can be very serious, but most of the time they're not. Most of the time it's something like, stepping on a nail is kind of maybe one of the more serious puncture wounds that someone would be likely to have. Jabbing themselves in the hand with sharp objects. So hands and feet are often involved in puncture wounds. Bites are a type of puncture, but they're more advanced. And we'll be talking about some things like bites and avulsions and stuff later on that are more complicated categories and subcategories of wounds. But for now, we're just going to talk about these ones. So this is kind of like Wound Care 101. So for all of these, there are certain steps that you want to take. The first thing you want to do when someone has a wound, an injury of this sort, is to look at it and kind of classify it and figure out what it is. And that can be, that's usually the first step. Somebody falls, they're in pain, they're like, okay, what's going on? Let me look at it. Let me see how bad this is. So this kind of ties in with with the process. This is part of the process of assessment that we were talking about last time. You have to examine and assess what the injury is and how bad it is. And how bad it is kind of has to do with, are they losing a lot of blood? Is there a lot of visible tissue damage? And is the person in a lot of pain or distress? So those are the three things you want to be mostly considering as you're making a preliminary assessment of it. Is there a lot of bleeding? Is there a lot of tissue damage? And is the person in a lot of distress? So you want to determine that, and then you want to determine what kind of wound it is so that you know what about next steps. But for all of them, there are some general strategies that you're going to want to use. One of them is you want to stop any bleeding that's going on, or at least manage any bleeding that's going on. And you don't always want to stop it right off, but you want to manage any bleeding that's happening. Another one is that you want to make sure that the wound is clean. You want to make sure that the wound is protected from the outside environment, and you want to encourage healing of the tissue. And you may also want to take measures to relieve the symptoms of pain and inflammation. And that depends on, whether those symptoms are present and to what extent. So that's true for all these different wound types. With bleeding actually does clean out wounds and does help to remove stuff from wounds because it's flow of liquid that's coming from inside instead of from outside. So sometimes it's initially better at dislodging stuff that may have been introduced into the wound. So if someone falls, say, on a dirty sidewalk and skins their knees, very common type of injury, good chance you've treated something like this on yourself or someone else at some point in time. If there is blood welling up out of the wound, it's going to kind of remove some of the dirt from the wound. it's gonna loosen it up at least, because it's coming up from underneath. So that's a good thing. Typically a scrape would not have a lot of blood loss. There would be some, but not a significant amount, not something where you would have to worry about managing blood loss or anything like that. But you do probably want to clean it up. So in terms of cleaning a wound, I like to use some water with gentle pressure behind it, not a lot of pressure because that stings and burns, but just a little bit of water from, sometimes I use a squirt bottle, sometimes I use a spray bottle. A lot of the time I have a little tiny 2-ounce bottle that directs a very small stream of saline. That's something I like to use a lot in the first aid station. Is something that will just sort of rinse out small particles of dirt or something like that, have enough force to do that, but not such a big stream that it's actually going to feel like somebody's slapping the injured area. So just a gentle stream of water. It's good to have something to absorb that water after it runs off the wound, like holding a towel below the wound and rinsing water over the wound and into the towel or paper towel. Is a way of keeping from making a mess, keeping from getting blood all over the place, that sort of thing. So just water is a really good thing to start out with, because with water you're not trying to kill germs, you're not trying to sterilize the wound, you're trying to physically remove dirt and bacteria. So the best way to lower the bacterial load on a wound is to physically remove them with flowing water. And that's a thing that you have a limited opportunity to do at the beginning of the injury process before they work their way into any sort of tissue or anything like that. You can't just rinse out an infected wound and call it a day, but you can rinse out a fresh injury and often keep it from becoming an infected wound in the first place. So gentle stream of flowing water or saline solution, which is just salt water. And that's a good thing to start with. It sometimes is necessary to do more than that to a wound. If there is a lot of if there's, if it's at a higher risk for contamination, which we'll get into more of that in a minute, of what that exactly means. But in wounds that have a higher risk of contamination, it's a good idea to also apply something antibacterial to the wound. So that's something that we might, that you might want to do, is also, after you've rinsed out the wound with water, maybe just very briefly rinse it with something else that would kill germs. So peroxide is a conventional chemical that's used for that. Any tincture that contains alcohol is going to have a pretty strong topical antimicrobial effect. Yarrow is something that I use a lot for this situation. I keep a spray bottle of yarrow here in the first aid station. It's empty right now because I make it up fresh, but it's, boiling water and then putting it into a sterile bottle so that you have sterile water with yarrow infused in it is a good wound treatment, because it kills a lot of germs and it helps to promote tissue healing. So that's another thing that you can use, and that's an herb that we've looked at some in the past, and that's a good kind of thing to use on a new, clean looking wound that's been rinsed out. The next step after that is protecting and covering the wound. Depending on what the wound is, you don't always want to, you might want to let it breathe, especially if it's a very superficial wound. You might want to let it breathe and dry out some, like a scrape. With a puncture wound, you don't really want to necessarily you do want to cover those because you can't really let them breathe. Essentially, there's an area of the wound channel that's not open to the air, so that's kind of a different story. But it can be good to let wounds breathe and dry out a little bit. Maybe put something on them like an absorbent bandage that actually allows some airflow and allows some drying. A nice clean piece of woven cotton material can be good for that. Disposable bandages, Band-Aids, things like that can be useful too. A lot of them are made so that they don't stick to the wound. If you have a nicely woven thing, it's not going to stick to the wound so much either. If you try and pack it with cotton batting, that is going to stick to the wound terribly. If you try and do it with gauze, that's going to stick really bad too, because the fluids from the body are going to clot on it and dry on it, and it's going to be hard to remove very easily compared to the other things that I was just talking about. But if it does get stuck, you just have to get it wet, and that will make it easier to come off. So covering the wound, a lot of the time with wounds, what I like to do is put a little bit of sesame oil or one of the healing salves that I've talked about on the wound, and then cover it with a wound dressing, which helps to prevent the wound sticking to the dressing, and it also provides some kind of protection on a cellular level from the environment. The oil actually forms a small layer that's like another membrane over the cells that keeps stuff from coming in direct contact with them as easily. It does keep the wound from drying out, which you may or may not want. Abrasions you really do generally want to let dry out. Lacerations and incisions and punctures you don't so much, because they won't really dry out except at the surface level, and the surface level might shrink up some when it dries. The edges of the wound might dry up more and not knit back together properly, and then you have some non-viable tissue, might lead to some scarring and that sort of thing. Hang on just a second. And the next step at that point would often be to work on doing something to reduce pain and swelling. There are a number of approaches to this. One very common approach is just to use cold, especially on contusions. Put some ice on it, or run water over it, or something like that. That's good for things like contusions and abrasions that have larger surface areas. Doing something cooling like that, physically cooling, can often be helpful, especially at first. Some of the herbs that we've talked about have anti-inflammatory properties. So if they're actually applied to the wound before covering it, sometimes that can help. Plantain is a good example of that. It has some salicylates in it that help to reduce pain. So internally, you can also take pain relieving herbs like willow or violet extracts that are going to reduce just the feeling of pain a little bit. that can be really helpful, especially at first. After the wound has dried up, after it's stopped bleeding and is either dried up in the case of an abrasion or kind of knitted together in the case of a laceration or a puncture or incision, which with those, you want to take extra care to irrigate the wound channel. You want to actually be getting some water down into the wound and letting it come back out and kind of rinsing out anything that's in there. Punctures, if you think they involve anything other than the skin and the layer right under the skin, is probably not a good do-it-yourself kind of treatment. If somebody gets a nail that goes into the joint of their knee, that's definitely not something you want to try treating at home. But the more minor things like stepping on a needle or something like that, you can deal with. Stepping on a nail is kind of could go either way depending on how bad it is. You want to irrigate the wound really well. Sometimes vulneraries, like some of the wound herbs that we've talked about, yarrow and plantain in particular, which we talked about pretty early on, they can be really good herbs to also rinse the area with. And you can do that with either fresh tea made from them or with the tincture. Tea is going to be pretty close to sterile because you've used boiling water to create it and it's still too hot for anything to start growing in. Tincture is going to be pretty close to sterile, if not entirely sterile, because it's going to contain alcohol. The thing about alcohol on a wound is that it is going to sting. If you put a tea on, you should let it get to sort of bath water temperature before you apply it, so that it's not going to burn or scald, but it's just going to be warm and warm enough to be reasonably close to sterile. So those steps can be taken to help the thing heal. After it's started healing, you might want to use demulcents, which are soothing, slippery type herbs that would help the scabs not to crack. They'll help the tissue to heal up faster, and they will generally tend to make the area less painful. So two of those that we've talked about would be marshmallow and sea moss. And both marshmallow and sea moss have some disinfectant properties too. So as you're applying those to a healing injury, you're also going to be keeping new bacteria from getting into the wound. Now, if there's bacteria down in the wound and it's starting to turn into an infected wound, it's not really going to reverse that process, but it will keep anything new from getting started on the surface while you're doing that. And like I said, it helps the tissue to be supple, helps this not to have like dry cracked scabs or a dry cracked scratch or incision or whatever, which can be painful and unpleasant. Sesame oil, we talked about how that helps with tissue healing. So in promoting tissue healing is a really big part of the process. Sesame oil is kind of my very baseline thing that I would use in that situation. Other oils would work too. If you wanted to use some other oil that was more available to you, like olive oil or walnut oil or whatever happens to work with your material culture, with the things that are around you that are easy to come by where you're at. Sesame oil does contain some special substances that make it particularly good at that, but so do a lot of other plant oils, because most seeds, almost all these plant oils come from seeds, and most seeds contain things to keep them preserved, keep them from rotting. Otherwise, they would not live long enough to germinate. So most seed oils are going to contain some antibacterial and anti-infective, antifungal types of components. And it's certainly true of walnut oil and olive oil. And I'm not as familiar with how that works for some of the other oils that are commonly out there. So protecting the wound, promoting tissue healing, very important steps to take with basically every injury, basically every time that the integrity of the skin gets disrupted. It's good to provide some kind of treatment to it. So all of that is are good steps to take. And as you go along, you need to continually assess the wound. You want to look at it every day or so, especially if it's a more significant thing. With a scrape, you know, it might just be that one day it's a scrape that's oozing and bloody, and the next day it's a dried up scab, and then, you know, a few days later, the scab's gone. And that's kind of the best case scenario. With other wounds, like with an incision, you really want to keep checking on it. You want to make sure that that it is getting less livid. The second day, it might look a little gnarly, but by the third day, it shouldn't look worse than the second day. So, and what I mean by that is some things you would want to look out for are drainage of any color other than clear. Clear or straw colored drainage, maybe with a little bit of blood in it, is a pretty normal thing to see in a wound that's on its way towards healing. That's a fairly recent wound. What you don't want to see is cloudy colored or greenish or yellowish drainage from a wound. You don't want to see bluish drainage either, but you seldom would. Unless you were working under very unhygienic circumstances, but there are things that cause that. So you mostly want to see that the wound is getting less weepy, less livid, so it's not as much color caused from increased circulation around the area. You want to see less rather than more swelling around the wound, and you want to see the wound itself appearing to get smaller over time, you know, so the actual area of the incision shortening. And, you know, you may have a scar sometimes, but you shouldn't have an incision lengthening. You shouldn't have a laceration that's continuing to tear open or anything like that. You don't want to see a puncture wound where the entry hole is getting larger and larger either, because any of those things indicates that tissue is continuing to be disrupted, tissue is continuing to be destroyed, and usually that continued destruction is by bacteria, almost all the time. Sometimes it can be from mechanical causes, like for example, if a wound is on a moving part of the body and that part is moving a lot and it's causing further injury, it can be from, that's what I mean by mechanical reasons. Sometimes it can be a chemical type of thing if there's been, you know, a wound that's poisoned with something, but that's not such a common scenario either. So in simple wounds, you should see them getting better and better after, you know, after the first 24 hours. They should start getting better and better. When they first happen, they might not look like much, and then it might turn into a big bloody inflamed mess as circulation goes to the area and as there's an inflammatory response and so forth. So the first 24 hours, I wouldn't necessarily say this, but after the first 24 hours, it should just continue to look better and better. And if there's any variation on that, then something is wrong that needs to be addressed. So with looking at considerations for specific types of injuries, like I said, with abrasions, scrapes, usually it's just a matter of cleaning it, maybe covering it so that there's not physical irritation happening against it, and putting on some soothing stuff to help the tissue be supple and heal, like marshmallow, like sesame oil. And generally speaking, if I'm going to apply something that's oil-based and something that's not oil-based, like if I were going to put a tincture and a salve on something, I would put the one on first that's going to dry out, which is the tincture or the tea or whatever it is, not the oil, which is going to endure and stay there. Because the oil is actually going to be a barrier to other fluid getting absorbed into it. So if I were going to put some kind of something like plantain or yarrow to rinse it out with, and anytime you're doing that, you want to make sure that you're not introducing bits of plant material into the wound. So you want to make sure that it's very well strained through something like a coffee filter, where there are not going to be bits of plant coming out. Anytime you're doing that, you want to do that before you put oil of any sort on. Of course, last time we talked about emulsions, where you could have something like marshmallow and sesame oil emulsed together into a sort of cream or ointment. And in that case, there would not necessarily be one than the other. It would be both at the same time. But for the most part, I like to do one than the other. So putting marshmallow on to sort of soften the wound, and then after that's had a minute to dry a little, putting some sesame oil or some wintergreen salve on over top of it to help seal it in and help promote healing. With abrasions and with contusions, contusions don't typically have a lot of blood loss, or what blood loss they have is under the surface and it's minor. So bruises don't necessarily need to be washed or anything like that. Although sometimes putting cold on them in the immediate aftermath is helpful. And I really like anti-inflammatory herbs for them. Arnica is a commercially available herb that doesn't grow where I live. There are varieties of it that grow out west, and there are varieties of it that grow in Europe and Asia. But arnica is a poisonous herb, shouldn't be taken internally, but topically, there are some good arnica products that help with contusions. I usually use wintergreen or sweet birch based salve for that sort of thing. What all of them are doing is helping the circulation in the area reabsorb the blood clots that have happened. So you get hit with something, blood leaks out of the blood vessels and into the surrounding tissue. It clots up and it forms a bruise that you can see from the surface usually. And then something like arnica or wintergreen, when it's applied to it, will actually cause that to break up, cause those clots and bruises to start disappearing, and allow the circulation of blood that's happening around it to kind of take some of that material back out of the area. After the first day, I would not put ice on a bruise again. Actually, after the first 20 minutes or so, I wouldn't really put ice on it again. I don't use ice a lot in my practice. I don't use cold a lot in my practice. But in that situation where you might have blood coming out of blood vessels, tiny blood vessels, the application of cold will help those blood vessels to clench up a little bit and might result in a less extensive bruise. But that only applies to the first several minutes that it's going on. After that, it's kind of done what it's going to do. And heat can actually be helpful at that point in getting the bruise to go away. So I will often put on the wintergreen salve and then do moxa over that to bring in the circulation and increase the blood flow and help the bruise to go away. Some people think that bruises are potentially damaging the tissue around them. That's hardly ever true. If somebody gets a bruise on their ear, then that can be the case there because you have blood that's up against cartilage, and it can cause some changes in pH that aren't good for the cartilage. Let's see. So for the most part, doing some of these salves or ointments and heat after the initial bruise has kind of set in, which usually I would do it the following day, rather than right after. I might put the ointment on right away, or 20 minutes after the bruise occurred or something, but then do the moxa the next day to help it to dissipate. Sometimes you won't get a bruise if you do this. Sometimes you'll get something that would have caused a bruise. You ice it, and then you put the wintergreen salve or the arnica on it, and then the next day there isn't a bruise there of any visible sort. And so that can be a good way, that can be a good approach to kind of preventing them from getting bad. With the deeper types of wounds, you do have to be more careful. So with incisions, lacerations, and puncture wounds, one thing that you have is that there's an area of tissue that has been separated from another area of tissue by force. So in other words, like the two sides of a cut. If somebody gets a slice down part of their body, part of their skin, there's going to be an opening between two pieces of skin that should have been right up against each other. So closing that wound up is an important part of the process. It can make a huge difference in the wound's ability to heal. It can make a huge difference in the cosmetic after effects of whether there's scarring, and it can make a big difference in deeper levels of scarring that might affect movement and function in the area. An example of this would be somebody that treated in the medicine wagon a few years ago who had injured their foot with an axe. They dropped an axe, or maybe they were throwing it, I'm not sure, but it cut through their shoe. It made a full thickness cut into their foot, and it introduced a small piece of shoe into the wound channel. So when I was looking at it, they had a slice in their foot. You could see the fatty tissue. You could see the inner workings of the foot below the skin, and there was a little bit of fabric from the shoe that had been introduced into the wound channel. So sorry if that's kind of gnarly, but the way that could have turned into a really bad wound. That could have turned, if it had been left alone, it probably would have been infected the next day, and it probably would have caused pretty bad scarring, possibly, worst case scenario, something like gangrene, or something requiring extensive treatment and maybe surgery on the foot. But none of that ended up happening because it was possible to rinse the wound out and just sort of the piece of material was mostly removed, or mostly brought to the surface of the wound channel with some water pressure. And this was done while just sort of gently holding open the sides of the wound and squirting it with some saline, and then wiping it off, which took away some of the blood, took away the piece of fabric, and then getting the two sides of the wound to line up with each other. And then once the two sides of the wound were lined up to each other, taping it up, closing the wound using wound closures. I really like butterfly closures, which are one type of wound closure. There's another kind that are wound strips that are just kind of long pieces of special tape. There are really good adhesives out there right now for use on the human skin. There didn't used to be. I talked about this in the very first day about using white pine bark and white pine sap as an adhesive and a bandage on serious injuries, which is something that I've done in the past and would do again if I had to. Although the thing about pine pitch is you have to warm it up till it's completely liquid, and then you have to put the closure in it, the bandage down in it. You put the warmed resin on the skin, hold the wounds together, and then put the tape across that so that it holds the wound closed, or the piece of fabric or the piece of bark across that so that it holds the wound closed. And that's very cumbersome compared to some of the modern adhesives. So I really like some of the available modern adhesives for wounds. So wound strips and butterfly closures and things like that. Some of them work very well. Some of them work at least as well as stitches. And so it's a good thing to know about and to maybe practice using. But but you just basically want to get the two sides of the wound to line up nice and evenly. And if you do that, and then you put something along the wound that can contain some oil. I usually use a piece of sterile sponge that's been soaked in a little bit of sesame oil or wintergreen salve, and put that right over the line of the wound, and then put a big bandage over that, over the whole thing. And that really helps it to heal up. So I did that with that particular wound. I looked at it 24 hours later, and if I hadn't known what it was, I would have just thought that it was a superficial scratch. It just looked like it wasn't livid, it wasn't separating. It just looked like a small scratch on the surface of the foot. And afterwards, it was able to heal up and not turn into anything worse than what it had initially been. So that's a good example of how a little bit of appropriately applied first aid can make a huge difference to the outcome of a wound like that. With lacerations, it's harder than it is with incisions, because the margins are less regular. Sometimes it's almost like a jigsaw puzzle, or like two pieces of a torn rag, and you're trying to put them back together as closely as you can. Often this results in small gaps, like there might not be a way to line it up where it's nice and neat. Or if there is, there might be a little bit of destroyed tissue along the tear line, so that there's a little bit of a gap between one side and the other. But the basic principle is the same. It's just a little more complicated to put into practice. And that's to create some compression with a bandage that's going to hold the two sides near each other, and to have some oil over the wound itself, between the wound and the dressing, that's going to create an environment that stays moisturized as the two sides of the wound are attempting to knit together. Because if they dry up, they're going to shrink away from each other, and they're not going to fit together well at all, and you're going to have more of a scar. So that's something with lacerations that makes them a little more complicated. But again, you would do that until they've healed up some, until the wound is dried up and it's not going to just fall open. Maybe 24 hours, maybe 48 hours, occasionally maybe more than that. And then you can put things on the surface that are for tissue healing and for soothing and that sort of thing, like the yarrow. I like to use a yarrow compress over wounds that are healing, which is where you take a piece of clean cloth or a bandage, soak it in sterile yarrow infusion, and put it directly on the wound. Yeah, so there was a question about Yunnan Baiyao, or Yunnan Payo, which is a traditional Chinese remedy. I have used it some. It doesn't grow on trees where I live, or on flowers, so it's a little something that I'm not as familiar with, but it's a very common, very widely used wound remedy in traditional Chinese medicine. And I like it pretty well. Some people use it as a powder form directly on wounds, and I'm not a huge fan of that, because I feel like it's introducing debris into wounds, and that feels a little bit off to me. It's not the worst thing you can do if the powder is, reasonably, you can have a reasonable confidence that it's sterile, but I feel like it could be irritating. But it is widely used, and you don't have to use it like that. It can be used as a compress or a poultice, where there's a barrier keeping it from actually getting in the wound. And so it's a widely used formula, and it does work pretty well for helping things to heal up. There's also an herb in Chinese medicine called qian qi. It's really hard to source in the US right now, but it's wonderful for taking internally to help wounds heal. And it's one that I used quite a bit when I was in Central Asia. And in that scenario, I was seeing all kinds of injuries and wounds that I would not typically see in clinical practice here in the US. Things like combat injuries from some of the civil conflicts that were going on and that sort of thing. So yeah, Yunnan Bio is a good, and like I said, it's really widely used. It's got an incredibly large fan base out there in the world. So it's a pretty decent thing to keep around. It's something that a lot of herbal medics keep on hand. I'm not as experienced with it as I am with some of these other remedies that I'm talking about. Mostly just because, like I said, it's not as much a part of my material culture. It's not something that is as readily available where I am. Of course, I can go online and order it, as I could do with almost anything, but it's not as readily available as some of the things that I do use. So puncture wounds are kind of a special class, just because you cannot see what is going on in a puncture wound. The wound channel is almost invariably very, very narrow and much deeper than it is wide. So you can't really usually look down into a puncture wound and see what's going on in there. And sometimes, like for example, if you stepped on a needle, there might not really even be much of an opportunity to irrigate it. You can try, you do the best you can. With that kind of wound, I often encourage drainage of the wound by using heat around the wound, by using a hot compress over the wound. Raspberry leaf is something that I've often used in a hot compress over a wound like that. In plantain, this is true of plantain also. They will sometimes, because they cause the tissue to tighten up around the wound, sometimes they will cause bodies that have been included in a puncture, like, if it's a broken off bit of something or whatever, sometimes they will get that to come to the surface. You don't usually necessarily know that there is a thing like that, but if there's lacerations involving broken glass, or if there is a puncture wound involving just about anything, it can be a good idea to use a hot compress of raspberry leaf or of plantain or of yarrow. And there are some other herbs that are good for this too that we haven't talked about yet, but these are ones that we have, to try and draw anything out of the wound, draw out any sort of impurities that might be down in the wound channel that you can't see. Someone asks about my experience with golden seal to pull stuff out. Yeah, golden seal is not an herb we've talked about yet, really, but it's good for that. It is traditionally used for that, as is another herb called yellow root that grows here and has similar constituents. They're good topical disinfectants. They'll actually stain the wound with stuff that kills germs, and so it's like they're kind of impregnating the tissue with something that is antibacterial. So they're really good for that, and they're strongly astringent and will sometimes cause things to be drawn out of wounds. Bloodroot's another one that's local that's used for that, and I think is very powerful, but is also potentially irritating. So it's one you have to be careful with. Golden seal is not as powerful, but it is, not as irritating either. So those can be used for that. Coptis is another herb that you might come into contact with information about. Coptis is a very similar herb to golden seal when it comes to that sort of thing. So it has that use as well. So encouraging the wound to drain if possible, encouraging any kind of material to be drawn out with herbs like this are good ideas. If a puncture wound is bleeding, which they generally will if they're not very narrow, a needle poke with a needle might not bleed, but a puncture from something larger than that generally is going to. I think it's good to let it bleed for a minute or two. If it's not losing, if it's not losing a whole lot of blood, and I'm pretty comfortable with wounds losing some blood because it actually really decreases the chances that they're going to get infected. And if something loses, you know, a few shot glasses worth of blood, for instance, you know, a few ounces of blood, say maybe up to 100 milliliters of blood, that's going to look like a lot of blood, but it's really not that dangerous for your body to lose that quantity of blood at all. So, you know, anything up to that point, I'm very comfortable with coming out of a wound and feel like it's actually beneficial to let it bleed a little bit. Now, if there's, you know, spurting blood loss, or if there's blood loss that's going on for a long time, or if it's more than, if it seems like it's more than that amount, then, you know, it might be a good idea to do something to stop the blood loss, like putting pressure on it. Putting pressure on it, but usually works and is the most important thing to know for that purpose. But vulneraries like yarrow will also help to stop bleeding. That's a really good thing to do if there's continued blood loss, or if there's very much blood loss. But I think a little bit of blood loss is actually helpful, especially from puncture wounds, because it's more likely to bring stuff out of them. Once that process has gone on, you just really have to be very vigilant with puncture wounds when it comes to infection, more so than other wounds. All these kinds of wounds can get infected, but puncture wounds are likely to get infected by anaerobic bacteria, which is bacteria that doesn't like oxygen. So they thrive in non-oxygenated areas. And so sometimes if there's a puncture wound, it'll turn into an abscess, which is just like a pocket of infection. And if that were the case, it would need to sort of be drained. It would need to be poked and drained using heat. And it would probably be a good idea to take something internal for infection as well. And, you know, depending on how large of an abscess and how significant it is, and whether it's causing a fever and that sort of thing, if any of that's going on, then it might be good to get some outside help with it. But if it's just, you know, a tiny little boil, something the size of a marble, that happens all the time, and it's not necessarily a big problem. Just lance it and put some heat over it, maybe put some cayenne salve on it to help it drain more fully, and take some garlic internally to kill off any sort of infection that might be trying to take root in the rest of your body. So at this point, you have the herbs to do quite a few things with. We've been doing this for, well, this is the 13th week, and so it's a good little arsenal of versatile and relatively safe herbs that you can use for things like treating this. So we'll be doing more of this kind of topic where we're looking at how we would use the herbs that we know about so far to treat things that you're likely to see in practice. So yeah, continued assessment of any kind of wound, but especially puncture wounds. And after they're starting to heal, St. John's wort as an oil is also a really good thing for putting on injuries. I had not mentioned that, but oil extract of St. John's wort is a traditional thing for helping injuries to heal up too. And it tends to speed up the rate at which cells are replacing themselves. The comfrey salve, I think I posted the recipe for that before, but I will check. And if I haven't already, I will do it again. No, if I haven't already, I won't do it again. But if I haven't already, I will post it in the comments section. I've got some of you sent me recipes last week, which I haven't posted yet, but thank you very much for sending those, and I will get those put up on the relevant video. I really appreciate seeing what everybody's working with and what kind of formulas you're all using. It's very interesting to see, very encouraging to know that you're making things and doing stuff with them. It's really, really good. All right, so Any questions about the basics of wound care before I go on to talk about the specific herbs for this week?
I have a question.
Yeah.
What category does a burn go under?
Burns are a different category, and we'll deal with them later. But
Okay.
they're most similar to an abrasion, but they're different because there is cooked tissue, and cooked tissue means that the proteins have been changed, which means that there's going to be an immune response. So we'll talk more about them after we've talked a little more about modulating the immune system, because that is going to come into that. But yeah, so they're kind of, I would consider them a more advanced category than the minor instances of these injuries. Yeah.
Okay.
Although most of the time I end up using aloe and vanilla on them. Vanilla extract mixed with aloe gel. It's really good for most burns. But you know, there's complexities to it and things you have to look out for, and when you're assessing them and when you're treating them. So we'll talk more about those in a future class. And they will probably get their own entire session.
Awesome. Thank you.
Yeah. Would envenomation fall into the burn category? In some ways, envenomation can be like a chemical burn. It depends on what it's from. A brown recluse bite is very, very much like a burn. A black widow bite is not much like a burn at all. Neither is a rattlesnake bite. They mostly work by poisoning the nervous system. But so it kind of depends on what the envenomation is from. But it can be like a burn. Let's see. So I want to talk about two herbs today, oak bark and skullcap. And these are herbs that I find very indispensable in my practice, and that have kind of been with me from the beginning, been herbs that I used for myself before I started treating people back when I was, you know, a child and that sort of thing. Oak bark can be from just about any kind of oak tree. Poison oak is not a kind of oak tree, and don't use the bark of it for anything I'm about to talk about. But most acorn-bearing trees contain what are called tannic acid and gallotannic acid and gallic acid, which are all different variations on the same molecule. And they're astringent, meaning that they cause tissue to tighten up. They're drying, and they're also emetic when they're taken internally, which means they will cause vomiting. They cause vomiting by causing the tissue of the stomach to tighten up around them, and that pushes them back out. They're also, they are acids that bind freely to other substances. They're not strong acids that will cause a lot of corrosion or anything, but they will change tissues, and they will bind freely to other substances. So that all comes into their medicinal properties. The most basic way of making a medicine out of oak is to make a decoction out of it. Bring the bark to a boil in some water and let it simmer for 20 minutes or so, and then let it cool. And you get a nice dark substance, rich dark brown extract. And depending on what species of oak you're getting it from, the intensity of how dark it is will vary quite a bit. White oak is kind of the standard traditional material of commerce, but some other oaks are stronger. Bur oak is a really common type of oak that's here, that where I live, that I consider to be medicinally equivalent to white oak. Some of the black oaks and red oaks are a little more intense. So this can be used to tighten up pores, can be used for oily skin and acne and that sort of thing, just by soaking, I get these things called cotton rounds, they're made for putting on makeup, but they're just little round pads of cotton. I use them a lot for this sort of thing, soaking them in a tincture or in this case a decoction, and then using them to wipe the skin with. So that's how I would apply this. Although, you know, a piece of cloth or a paper towel would work as nearly as well. But that's how I like to apply oak bark to the skin for tightening up the pores and for reducing breakouts of acne. And it's also good for other types of blemishes. Like, for example, if it's used on a cold sore, it won't actually treat what's causing the cold sore in any way that I'm aware of, but it will tighten up the sore, the tissue of the sore, make the oozing and bleeding stop, and result in faster healing time. So it can be used for a lot of things on the surface of the skin like that. In the past, I've used it for rashes and allergic reactions. It works reasonably well for that too. It contains a substance called quercetin, which is a bit of an antihistamine. So it can be used for allergic rashes on the skin, contact dermatitis, and that sort of thing. It can also be used inside the mouth for gingivitis, for bleeding gums, that sort of thing. It firms up the tissue, kills some of the germs. Using it a lot would probably stain the teeth, because drinking tea does stain people's teeth, and this contains some of the same brown coloring as tea, but I haven't ever actually seen it do that in practice. I've heard some limited reports from people saying that it does help to heal cavities, to heal, to remineralize the area around cavities so that they're so that they don't grow, and so maybe they even close up. I haven't actually tried that myself, but it is something that people say might work. I'm not endorsing it because I'm not sure that it does, but I wouldn't be surprised if it did either. On wounds, like what we've talked about today, oak is a very strong thing for wounds. It kind of is a sort of trade-off because it changes the tissue. I usually don't use it because it keeps a wound from ever healing completely perfectly if you put it on at the very beginning, but it does help if a wound is, if you had a wound that was not cared for properly at the beginning and had started to have a situation where part of the wound was drying up and pulling away from another part, oak is good for minimizing the damage from that. It will also keep a wound from becoming, if a wound is starting to run or get infected, it's a strong way of dealing with that. It really changes the chemistry inside of a wound if you rinse it with oak bark, and kind of alters the protein some because of the acid that's in it, and makes it so that they're no longer something that the bacteria can eat. And so it makes the pieces not fit together as snugly as they would, but if there's already some erosion going on as a result of infection, it can really help to put an end to that, and kind of turn around a wound that's going the wrong direction and make it start healing. The more dramatic thing that I've used oak for is gastric lavage, taken internally. It will make somebody throw up. So if somebody has taken more medicine than they should, and you want to induce vomiting, or if they've otherwise consumed something that could potentially harm them, and you want to induce vomiting, oak bark, a strong decoction of oak bark is good for that. I keep a concentrated oak bark product in the medicine wagon here, and what that consists of is it's oak bark that's been made into a decoction. It's been boiled down to a quarter of its original size, So in other words, make the decoction, remove the bark, boil it down till 3/4 of the water is gone, and then whatever volume you have left, add that much alcohol to it. So that results in something that's shelf stable and twice as concentrated as regular oak decoction. Because if somebody's just, tried to overdose on something, or, accidentally taken too many pills at a party or a festival or something like that, you don't want to sit around spending half an hour making a nice cup of tea for them. You want to have something that you can give to them right away. So that's not always going to be something you want to treat on your own, obviously. But if you do need to induce vomiting, that product, that version of an oak bark extract can be a really good way to do it. You can, a lot of the time, take that, induce vomiting, and then usually what I would do is have them take a lot of water along with some activated charcoal and then do it again. So you're just kind of washing the stomach out is the idea. The activated charcoal helps absorb foreign substances, and the oak bark induces vomiting. So I usually probably have two of them together. So yeah.
Would you, when you say do it again, do you mean repeat the whole process where you induce vomiting, add water, do the activated charcoal, and then right away do you induce vomiting?
Yeah.
How
It's
many
probably-
times do you repeat the process
I usually just do it
for
twice.
an overdose?
I would
Just
usually just
twice?
do it twice. Now, this is like not something that this is not something that's going to help for somebody who's already in a state of overdose.
Okay.
It's something like if they've taken the medicine, but it hasn't gotten into their bloodstream yet, it's still in their stomach, which, some of
Okay.
it might be. And you don't ever want to try and induce vomiting in a person who's not fully conscious, really. So, because then they'll, end up inhaling some of it or whatever. But
So
yeah,
like,
yeah.
so like when, sorry, so like when I was working at the homeless shelter, we had to know how to use Narcan. Is that how you
Narcan,
pronounce it? Yeah, Narcan. Is that the same process that I could use?
It's different than when you would use Narcan, because I keep both here in the mobile clinic. Well,
Okay.
all three. I've got the activated charcoal, the Narcan, and the concentrated oak extract.
Right.
It says DAR
This
on it.
isn't
That
wound
means
care though.
Percus alba. So yeah, this is not for bringing somebody up from having lost consciousness like the Narcan is. It's for if somebody has taken too much of something and you're trying to get what's still in their stomach out. So that's,
Does it work for alcohol poisoning also?
Yeah, it does. But then there again, only what's in their stomach at the time. So if with what's in their bloodstream, you kind of have to do stuff to support their liver and kidneys and other things like that.
Okay.
Yeah. So the activated charcoal I use is store-bought. You can activate your own charcoal by burning wood until it's charcoal and then steaming that, which kind of makes it sort of puff up and get crumbly, and then crumbling that in a mortar and pestle. It's a horrendously dirty and involved process, and I don't like doing it. And the stuff off the shelf is cheap and just about as good. So that is an area where I do buy the stuff, but I think it's important to know how to make it if you weren't able to buy it. And then, yeah, this is the oak extract. This has probably it takes about 2 ounces of this to induce vomiting. So there's enough in this size bottle to do that about 8 times. I've never done it more than a couple times to anybody, but often if somebody had taken something sedating, you could use that to get what's in their stomach out, and you could use something like caffeine to keep them from going to sleep. Although, this, if possible, might be a situation where you would want to get somebody to a hospital where they could be more closely monitored and that sort of thing, because it can be a very involved process. Fortunately, it's not something I've had to do a lot of times, but it is something that I have done a few times in the course of my career, and that very grateful for having had the ability to do when needed. Yeah, you'd have to do it before it goes too far into the intestines for sure. Which a lot of tablets are going to break down in the stomach and get absorbed in the first part of the small intestine. So really, by the time they're in the intestines, they're mostly in the bloodstream. But yeah, this is just going to bring stuff up from the stomach for the most part. If you did it repeatedly, you know, you might start bringing up some chyle, some intestinal juices and stuff. But that's a really harsh purge. You know, it's not impossible to do, but it's not necessarily something you'd count on working if something was past the point where it would be in their stomach. So, you know, it's a sooner the better kind of a thing, which isn't always something you have the opportunity to do. If somebody's trying to intentionally overdose or something like that, and they might not tell you, or if they're just not with people who have the responsibility or presence of mind to realize that something has gone wrong. Yeah. So oak is good for that. Small amounts of oak can be taken internally that are not going to induce vomiting. Say if you took a tablespoon of the oak extract in a glass of water, and that is something you can use to slow down watery diarrhea. And that's important to know because it's, you know, one of the main things that would cause people to become dehydrated and that sort of thing is having a situation where they're losing too much fluids and too much electrolytes through their movement of their bowels. So oak is a symptomatic relief for that. It doesn't necessarily kill whatever is causing the problem, but it will tend to slow down the diarrhea to the point where you might actually have a better chance of it. Because, for instance, if you were taking something antibacterial, but you had very intense diarrhea, your body might not get a chance to absorb it. But using the oak will slow things down, which will keep you from getting as dehydrated as quickly, and it will make it potentially easier for your body to have time to absorb something through your intestines. So in a very small dose, it can actually help with absorption if absorption is a problem. And in a larger dose, it can, you know, prevent absorption by inducing vomiting. So depending on dose, it can work in both ways, in both directions in a sense. Now, I will say when harvesting oak, it's really important that you not kill a 500-year-old oak tree for a few ounces of oak bark. And you could if you did it wrong. So it's good to get oak bark off of small branches that are being properly pruned. Or, you know, if you have a tree that falls or something like that, or a branch that gets struck down by lightning, that's a great time to harvest some of the oak bark. You know, you can tell people that it's lightning struck oak and that it has special mystical properties as a result. I don't know that it actually does, but you know, it sounds kind of spooky, doesn't it? Yeah, oak trees get struck by lightning fairly often because they don't contain a lot of oil and they contain some electrolytes and stuff. So they're actually better conductors than most other trees, and they're tall. So a lot of the time oak trees will get struck by lightning and lose a branch or part of the crown that way. And you know, if you get something like that, you can stock up on oak bark and it keeps forever. If you keep bugs out of it, if it doesn't get wet, it keeps for basically forever. You could probably use it in 100 years and it would still be good. So if you get, you know, a big piece of oak tree that falls and you get to harvest the bark from it, you can harvest all the bark you need for the rest of your life pretty easily, and not have to worry about it again. But yeah, it's very, very important not to take oak bark from the trunk of trees. You want thick bark. You don't want the thin bark that's on a very small oak tree. You want the thicker bark from a mature oak tree. But, you know, you definitely don't want to kill a 500-year-old tree for a few ounces of medicine. That would be, you know, that would be very bad. Possibly engendering the wrath of the fairies or whatever. But yeah, oak is a really good medicine. I think I really have a lot of respect for oak trees because they do a lot to create micro habitats around them, and animals live in them, and animals eat the acorns and things like that. So they really are sort of a very important key piece of the ecosystems around them. And so I think it's important to keep that in mind when using their medicine and when harvesting their medicine, especially. They're, you know, important members of the forests and fields that they grow in. Now, the other herb that I want to talk about is skullcap, not to be confused with monkshood, which is a deadly poison. The skullcap is a member of the mint family. Scutellaria is the genus. There are multiple different species. Scutellaria lateriflora is the one that I mostly use in my practice. People sometimes call it mad dog skullcap because it has had a reputation for being a remedy for rabies. I have never had the opportunity to use it for rabies, so I have no comment as to whether it's actually something you could use in that situation, although I have my doubts. But what I use it for is as what we call a nervine sedative. And so this is a whole concept in herbal medicine that's a good thing to be aware of, is there are certain plants that are what we call nervines, which means that they're for supporting the nervous system. And a nervine sedative is an herb that in the short term, when you take it, causes sedation, causes you to feel calm, causes you to feel sleepy, that sort of thing. And over the long term, has a tonic effect on the nervous system, a strengthening, tonifying effect on the nervous system. So this is kind of like the opposite of what benzodiazepines do. With a lot of conventional anxiety medicines, you need more and more of them as time goes on, and maybe you can't live without them very easily. With skullcap, you are likely to not need it as time goes on, or to need less and less of it, because it actually is doing stuff to the nervous system that has a lasting effect that's beneficial, rather than just calming you down or slowing the messages in your nervous system or increasing the calming messages in the nervous system. So the pharmacology of skullcap has not been very well elucidated. There is stuff in skullcap that we don't know the names of chemically, that is probably mainly responsible for what it does. There's been a lot more research into the use of the roots of Chinese skullcap, which is mostly used as an immune support type of thing, but less into the European skullcap, which also grows around here. It also grows in China, but the Baikal skullcap, which grows in China and in parts of the former Soviet Union, former Russian Empire, is well researched as an immune support herb. But the skullcap that I'm talking about is more the tops of the plant that are used for as a nerve tonic and sedative. And this is probably the plant that I use most frequently for the nervous system. there are lots of plants that I use for the nervous system for various different aspects of nervous system function. But this is probably the one that I use the most frequently and find to be very versatile overall. One of the main things I use it for is sleep. It promotes a really nice state of sleep that's doesn't tend to make people drowsy the following day. It's stronger than chamomile in terms of producing sleep. But it ultimately is just sleep. It's like a fairly normal, regular sense of sleep rather than a sedation that's hard to wake up from, or a weird dream type of sleep like what valerian might cause. So that's one of the things I use it for very often, because in my opinion, there's no way to have mental health without having good sleep. So getting people to a state of good sleep is a huge part of the healing process. And whether somebody can't sleep because of something that's innately related to the nervous system, or whether they can't sleep because of pain, or they can't sleep because of some other discomfort in their body, skullcap can really be helpful for that. So because of that, it's something that can really, help to aid the healing process by helping to give people the good sleep that they need. Additionally, it can be used for twitches and tremors and things of that nature, and it can be used for cramps. So it actually relaxes the muscles. It's a skeletal muscle relaxer. So it can be used for a lot of situations where people are just too tense. If somebody's getting frequent headaches that seem to be tension headaches, or if somebody comes to see me because they've had a headache for a couple days, that's usually tension related as well, then skullcap is going to be one of the first things that I'm reaching for. If somebody is in a very confused state of mind, or having delusions or something like that, sometimes that's actually a hidden result of, or that's the result of an unknown sleep disorder. And so it can really help with those things some of the time. And as far as anxiety, it's a really good herb for just calming people's nerves. So a lot of the time, if somebody has a lot of anxiety, what I'll do is give them something like a bottle of skullcap to take a spoonful of every morning, and then maybe a dropper bottle that they can take a few drops under their tongue as needed throughout the day. So, sometimes I would do that with skullcap in both of those roles, and sometimes I would do skullcap in one of those roles and something else in the other. But skullcap is my favorite herb for, well, not always. It's one of my favorite herbs for promoting sleep. And all in all, it's probably the one that I use the most frequently. It's not a native plant here, but it does grow here pretty prolifically. And if you find a good stand of skullcap, you can usually go back to it year after year after year and gather from the same spot, unless the environment around it changes. It likes to grow in fields that have partial sun. So sometimes it'll be growing near the tree line, or sometimes it will be growing in a clearing in the forest. And as long as those areas are mostly clear, but with some trees nearby, the skullcap will usually keep growing. If the forest gets cut down, or if the meadow becomes a forest, then sometimes the skullcap will go away, or will stop growing in the same spot. But it's very persistent. It's very long-lived, so you'll have the same, not necessarily the same individual plants, but the same stand growing in the same place for longer than a human lifetime a lot of the time. So it's a good, not quite the same situation as oak, where you can harvest it once for the rest of your life, but definitely where you can find the stand once and maybe rely on that same stand for many years. So yeah, it's an herb that I really like, and that I use a lot of. The nice thing about it too is that it has a fairly self-limiting quality. I've never seen anything that seemed like an overdose of skullcap. It's just kind of, if you take more than enough, the main side effect of it is that you run out faster. It doesn't necessarily have a more dramatic effect once you get past a certain dose of it. It kind of just makes you feel sleepy, and then if you take more than that, it just does the same thing. It doesn't necessarily do a much more dramatic version of the effect, and that's useful. It might sound kind of frustrating as I'm describing it, but it's really useful to have something that's not going to that you're not going to overdo it on. The worst thing that I've known of happening from skullcap is that somebody overslept. So it's really I advise the same caution with it that I do with any sedating herb, that somebody shouldn't drive after using it until they're used to it. And that you should be careful of drowsiness and things like that if you're doing anything that's sensitive to that. But it generally doesn't make people feel drowsier than they should be. Now, if they're running on caffeine and they haven't slept in days, and then they take skullcap, they're going to feel like they haven't slept in days. It's really going to make them feel their tiredness that's actually there, and it's going to make them want to sleep the amount that they actually need to sleep. But it's not going to dramatically escalate that, or make them a lot more tired than they should be. Like with most things, skullcap can be used as a tea or a tincture. I keep it in the clinic in tincture form because that's a convenient way to dispense it. But a nice warm tea can actually increase some of the calming and relaxing effects that the skullcap has on its own. So that's not a bad idea either. I don't do anything oil-based with it. I don't do anything topical with it. There probably are applications, that someone could experiment with and find of what would come from it if you made an oil out of it, or what effects it might have on the surface of the skin. But it's not a way that I've ever seen it used, and it's not a way that I've ever used it myself. So anyway, it's a lovely herb that everyone should get to know, and I hope that you will. And it is commercially available. It is something you'd order from Frontier or whatever, and it is, like I said, a weedy species here in Eastern North America that you could probably go out and harvest if that's what you wanted to do as well. And like most members of the mint family, it doesn't really have any appreciable toxicity at any dose that it would normally be getting consumed at. There probably is a dose at which it causes some kind of problem, but not anything that you would normally encounter. The hoary skullcap and downy skullcap that also grow around here are similar, very similar. They're maybe smaller plants, the way they grow and stuff is different, but medicinally they're pretty much indistinguishable. So yeah, it's a large genus. There are many different kinds of skullcap, but just a few that grow around here. And the ones that grow around here are pretty similar to one another medicinally, but different from the root of the Chinese skullcap. So if you were to try and order some, you don't want the root of Scutellaria bicalensis. You want the leaves of Scutellaria lateriflora or something similar to that. All right, so I wanted to talk a little bit also about the herb walk on the 6th. The place I want to go to is called Tom Dorman Nature Sanctuary in Garrett County, but I'm not exactly sure how you get into it now because the entrance is not where it used to be. So I'm trying to figure that out. And if I figure that out, that's where it's going to be. If not there, it's going to be at another nearby one. There are a couple nature sanctuaries that are right in the same area that kind of access the same bioregion and stuff. And it looks like we're going to have a pretty good turnout. Some people are going to be traveling to come here to it, and some people are, you know, local and stuff. So that it looks like we'll have a pretty good little group of people. Just like before, it's rain or shine. So if it rains that day, we'll just get wet, and if it's very hot that day, we'll just kind of get all sweaty. But either way, we'll go out in the woods and see some good plants, and I will take video of that also to share with everybody afterwards if you can't make it to the event in real time. Kim knows where the entrance is. So she said it's located off the southbound 4-lane after you cross the Camp Nelson Bridge. Okay, yeah, well, I'm sure I'll figure it out. Last time I tried to go there with my GPS, and it like took me to a neighborhood and told me to go between two people's houses. And while I could see that that was going to get me into the place, it didn't look like the right thing to do. There wasn't anything marking it as, you know, anything other than going through someone's backyard and jumping the fence, which I didn't really want to do. So yeah, I haven't been to the new entrance, but I'm sure we'll find it. And I appreciate you telling me where it is. And it's a really nice area. It's a nature sanctuary, but it's got a lot of good stuff growing there. And it's an area where I've walked a lot, so I can be able to say, you know, okay, here's going to be a stand of this particular plant, and, you know, have a good idea what we were going to see, more so than with the other nature sanctuaries in the area. Although, you know, we just find what we found in those ones, and I'd be able to tell you about it because it'll be the same plants mostly. But in this one, I know where the nice groups of plants are, and, you know, really, it's a good visual demonstration of how the geology of the place and the soil and the ground itself affects what comes up from it, and what plants there are to be had. And it's a little different at different times of the year. So if you are from around here, it's a great place to familiarize yourself with if you aren't already familiar with it. And most of the time, there's not a ton of people there, but we'll see what that's like. Maybe there will be a ton of people, but sometimes it's a lot less crowded than, for example, Raven Run, which is a nature sanctuary that a lot of people go to, that has similar geology and similar plants. Somebody asks for oak, if you wanted to try for remineralizing a cavity, what preparation method and dosage might you use? You would make a decoction of the oak bark and swish with that as a mouthwash twice a day. That's the idea. Like I said, I can't say for sure how well that works because it's not something that I personally have tried, but other herbalists that I, you know, have a pretty decent amount of respect for have said that they have seen it work fairly often. So yeah. All right. So yes, the herb walk should be a pretty different experience from the previous time. I will say that it is more walking up and down hills. It's a very hilly area, and it is probably a further walk altogether than what we did last time. So that's, you know, something to be aware of. But essentially, it should be, you know, a couple hours of being outside and getting to look at several different species of medicinal plant in their native habitat, or at least their natural habitat. And I think that that's a really, really good part of learning to be an herbalist, a really essential part of it, and also a really fun part of it potentially. So I would encourage everybody to come that can. And just like before, if you have children that you want to bring, or if you wanted to bring a friend or something like that, that's definitely something that I'm open to, just as long as everybody's, you know, clear on the fact that it is kind of a hike and it is up and down hills. All right. So, how long does that oak take to work? I think that it took a matter of a few months to work. Is the idea. Okay, nice. There's also a toothpaste that exists with white oak in it. That's good to know. I have not seen that myself, but makes sense that somebody would put it in there. Yeah, okay. So any questions about any of that? All right. Well, yeah, so just a second. So this question about thoughts on different qualities of different oaks. So generally speaking, the ones with all the oaks have lobed leaves, and in some of them the ends of the lobes are round, and in some of them the ends of the lobes end in little bristles and they're more pointy. So the ones with more pointy ends of the lobes, I said all oaks have lobed leaves, not all of them do, but the ones that have more pointy ends to their leaves with bristles on them, those ones tend to have more tannins in the bark. They tend to be more astringent than the standard white oak. And the ones that have the rounded leaves tend to be more close to identical to the white oak. That's sort of the standard medicinal species. Although they all, like I said, they all contain the same substances, just in different intensities. So in my case, I usually use white oak or bur oak to just kind of get a consistent product. But you could potentially get something stronger from red oak or black oak or some of the other varieties. You know, like I've said before, I actually prefer weak herbs to strong herbs most of the time. I think that using more of a weak herb is actually a superior approach to using a smaller amount of a strong herb.
Hey, Andrew.
Yeah.
Would skullcap be helpful for a restless leg syndrome,
Yeah.
or is there something better for that, or would that be your go-to?
It's a pretty good thing for it. It's often the first thing that I would try.
Okay, thank you.
Yeah, yeah. All right. Well, any other questions before we go? All right, well, thanks very much for coming, everybody, and I look forward to talking to you next week and to meeting up with you in the woods on the 6th. And yeah, if anybody thinks of any questions afterwards, feel free to send me a message on Gmail or call or text or whatever. Thanks a lot.
Thank
Bye.
you.
Thank you.
Thank you.
Thank you.